Welcome dear students in my course Determinants of Quality of Life. Today's topic we discuss is understanding preventive physical and mental health. Content of this module is Introduction to Preventive Health, Preventive Physical Health, Preventive Mental Health, Integration of Physical and Mental Health, Policy, Ethics and Population-Based Preventions, Applied Practices and Reflection, Key takeaways and learning outcomes. Learning objective of this module: by the end of this module, the student will be able to define and differentiate level and domain of preventive health, analyze biopsychosocial determinants influencing physical mental health outcomes, evaluate scientific evidences supporting preventive interventions, apply behavioral and policy models to design preventive interventions strategies, integrate physical and mental health framework to promote holistic well-being, critique challenges in implementing prevention to individual and systemic level. Physical and mental health connection is like this in diagram, that is showing introduction of preventive health. Is preventive health proactive measure to avoid disease and evolution from hygiene and vaccine to behavioral digital interventions. Preventive health care involves everybody healthy habits and recommended by your doctor, regular checkups with your primary care physicians, periodic health screening and immunization is the four pillars of preventive health care. Types of prevention is primary level to prevent onset, that is vaccine, healthy diet and exercises. Secondary type is early detection, that is cancer screenings, mental health check-ins. Tertiary is focus on reduce impact, that is the rehabilitation, chronic diseases management. Global health perspective. World Health Organization best buys by non-communicable diseases. UN Sustainable Development Goal 3, that is good health and well-being. CDC and National Health Schemes preventive health frameworks. Preventive physical health is exercises is an important part of preventive health care. Scientific foundations is for exercise physiology, role of aerobic and aerobic activity in cardiovascular and metabolic health, impact on inflammatory cytokines, BDNF and telomere integrity. Scientific foundation is nutritional science, anti-inflammatory diets, examples Mediterranean and DASH, gut-brain axis and the microbiome's role in chronic disease and mental health. Sleep science, circadian rhythms, lymphatic clearances, memory consolidations, sleep deprivation and cortisol dysregulation. Health monitoring and risk reduction is wearable and personalized tracking, screening protocol of lipid profile, HbA1c, blood pressure and BMI. Emerging technologies is AI in artificial intelligence in predictive health, genomics and lifestyle medicine, that is nutrigenomics, fitness and genetics. Emerging technology, that is the case discussion in this technology, evaluate the use of fitness apps in community-based obesity prevention program and write about this. Preventive mental health. Preventive mental illness is this slide is 100% editable. Adapt it to your need and capture your audience attention. Text here. This slide is 100%. Adapt it to your need and capture your audience attention. Core concept and epidemiological. Mental health is a continuum. Well-being, distress and disorder. That is the cycle. Your mental health is in a well-being. If he receives some stress, become the distress, and when the distress is reached at high level, become the mental disorder. Burden of mental illness, dailies, underdiagnosis and stigma. Theoretical frameworks is cognitive behavioral prevention, mindfulness-based cognitive therapy, stress vulnerability models, and positive psychology interventions. Neurobiological underpinning is role of HPA axis, cortisol, and neuroplasticity. Link between chronic stress and immune suppression. Neuroinflammation in depression and anxiety. Mental health promotion strategies are university and workplace mental well-being initiatives I discussed in earlier PPTs, digital CBT and self-guided tools, resilience buildings and emotional intelligence and social connectedness. Transfer of services, clinical discussion, service redesign and resource reallocations. Primary care is control of local mental health hazards and mental health promotion. Local community health and well-being services, that is the multidisciplinary management board. Self-care, information and psycho-education. By social care, implementation of social inclusion strategies. That is the primary care trust. Extended primary care out of our, that is mental health care need, that is the primary care trust is mental health professionals led triage system. Liaison between self-care and extended primary care. Intermediate care, that is the step up, step down, is the primary care trust is coordinated acute community hospital mental health services. Information care, that is coordinated acute community hospital and mental health services. Secondary care, that is the decision making, mental health managed clinical networks, co-opting coordinated group of health professionals working unconstrained by existing clinical service separations. Tertiary care, that is highly specialized evidence advice, is coordinated highly specialized mental health services, mental health, physical health and the disability services. Integration of physical and mental health. Holistic approaches, integrating physical and mental health. First of all is understanding holistic approach is 1 to 7. That is, first is understanding the holistic approach. Second, the role of physical health in mental well-being. Third is nutrition and mental health. Fourth, the mind-body connection. Fifth is integrating physical and mental health support. Sixth is benefit of holistic approach. And last is conclusion. Biopsychosocial model is interplay between physiology, psychology and environments. Influence of mental health on immune, metabolic and cardiovascular function. Psychoneuroimmunology is interaction between mental stress, inflammation and chronic illness that help in role of exercise, sleep and diet in modulating immune and neural system. Lifestyle psychiatry. Integrating physical activity and dietary counseling into mental health care. Preventive psychiatry approaches in at-risk populations. Video case studies about the depression management using of integrating physical mental model in primary care setting. That case study you see and write. Policy, ethics and populations based in prevention. First of all is physical, that is obesity and physical health. Second, cognitive, that is school achievements and entry into workforce. Social and emotional means mental health and well-being. And behavioral in crime, violence and antisocial behavior. Health behavior and preventional models is health belief model, trans-theoretical model of change and ecological model of health behavior that we discussed in other PPTs. Public health system and policies, comparing preventive health system, that is the NHS, US, preventive services, task force like NPCDCS and funding, access and health activity. Legal, ethical and cultural consideration means mandatory screenings versus individual choice, digital surveillance and privacy in preventive tech, cultural barriers to mental health prevention. Debate prompt on this is, should government legally mandate lifestyle changes? Example, sugar tax, mental health days. Applied practices and reflection. Integrated case design about this is group task. Design a preventive health program for a university and or workplace where you work or where you study. Include physical, mental, behavior and policy component. Reflection and self-evaluation about your personal health behavior audit and setting smart goals for personal wellness. Key takeaways of this module is, preventive health is a proactive, system-based approach integrating lifestyle, environment and public policy. Physical and mental health are interconnected through neurobiological, behavioral and social pathways. Effective prevention depend on interdisciplinary collaboration, community engagement and personalized strategies. Health promotion is cost-effective, sustainable and critical for long-term quality of life. Learning outcomes of this module is demonstrate understanding of how lifestyle, social and systemic factors contribute to disease prevention. Synthesize findings from exercise science, neurobiology, psychology and public health. Assess preventive health framework for specific population or settings. Design holistic, data-driven preventive strategies considering cultural and ethical dimensions. Thank you.